So today I will discuss one important sign of neurological diseases, that is seizures or fits. So there are different types of seizures: focal, generalized, absence, juvenile myoclonic epilepsy, benign Rolandic epilepsy, and febrile fits. Now, focal seizures are of two types: focal fits with impaired awareness and focal fits with preserved awareness. And generalized fits, they are usually tonic-clonic in nature. So, what are the causes of epilepsy or seizures or fits? Is the causes can be in the brain or causes can be metabolic. As far as the brain causes they are concerned, it can be trauma that can lead to subdural hematoma or extradural hematoma, which irritates brain and it becomes an irritable focus which spontaneously starts discharging. Or it can be a tumor. Tumor can be primary tumor of brain, or it can be secondary tumor, or it can be abscess. It can be infection like meningoencephalitis, or it can be infarction or hemorrhage. Then metabolic causes can be renal failure, hepatic failure, electrolyte imbalance, hypo or hyperglycemia, hypocalcemia. So all these things they can lead to seizures, or the other name for the seizures is fits. Now, so now the difference between focal and generalized seizures. Usually, focal seizures, there is a irritable focus in the brain because of any problem, which can be trauma, tumor, or any irritable focus, which discharges spontaneously. And the activity, it remains localized to part of the body which is being controlled by that irritable focus containing part of brain. While in generalized seizures, this abnormal firing of neuron, it spreads in the whole brain. It starts from a focal area, then it spreads in the whole brain. So this is the tonic-clonic generalized seizures, in which first of all the tone of the body is increased, which can be seen as straightening and arching of the body, then clonic jerks, and finally there is a post-ictal confusion phase. So this was about generalized tonic-clonic fits. While focal seizures, they're of two type. In one type, awareness is intact, while in the other type, awareness is lost. So investigations are CT and MRI, and then after that, we have to see the metabolic profile like blood glucose, serum electrolytes, LFTs, and RFTs of the patient. After investigation, treatment is, first of all we have to identify the cause and we have to rectify that cause. For example, if it is in the brain, then we have to treat the underlying cause. We have to evacuate the hematoma, we have to remove the tumor with the help of surgery, or we have to treat infections like meningitis and encephalitis. If cause is metabolic, then we have to correct electrolyte imbalance or other things. As far as the treatment is concerned, all type of the seizures in females, the first drug of choice is lamotrigine or levetiracetam, because it has less side effects and it is safe in breastfeeding and in pregnancy. While in males, the first drug of choice is sodium valproate or valproic acid. Except absence seizures. Absence seizures is actually type of seizure which occur in children, and here the children, they usually have fits which occur several times in a day, and they last just for 3 to 4 seconds, and it includes just as the child has lost his or her contact from the surrounding just for the few seconds. There are no jerks, or there is no tonic phase or clonic phase. So ethosuximide is the drug of choice in case of absent seizures. Then there is another type of the seizure which is called juvenile myoclonic epilepsy, which usually occur in young age, and the precipitating factor of this fit is stress or lack of sleep, and the drug of choice here again is sodium valproate. Benign Rolandic epilepsy, it usually occur in children, but as soon as they reach puberty, this epilepsy is also controlled, and usually it occurs during sleep time. As far as the febrile fits are concerned, again we have to control fever, and fits they are controlled automatically. Then there is a condition which is called status epilepticus, in which if it is prolonged for more than 5 minutes, or there are two fits which are less than 5 minutes, but patient is not gaining consciousness in between the fits. This is called status epilepticus, which is an emergency in which we give IV lorazepam or midazolam, and we can repeat the dose of midazolam and lorazepam as well. If patient it does not improve, then we can start IV levetiracetam infusion or IV phenytoin or sodium valproate, which is second line. And third line is, of course, that we have to shift the patient to ICU and we anesthetize the patient.